A lab report comes into my office for a new patient who has a positive TB culture on spinal fluid. He's the breadwinner of the family, his wife is pregnant, and he has 2 children. He works full-time as a teacher for grade 3 students at a large elementary school. Where will he be treated for his TB? Could he possibly be infectious? Do we follow up with his family? And if so, how? Do we follow up with his school? And what other services would he require? A 5-year-old comes into a hospital ER for the 3rd time in the last month with complaints of an ongoing cough, previously treated with antibiotics for pneumonia. A chest x-ray done at the hospital is abnormal, and I receive a call from the physician reporting that they suspect TB. How do I follow up? Where did this 5-year-old even get TB, and could it be spread to others? What about an elderly man who was just diagnosed with terminal pancreatic cancer that was reported to have infectious active pulmonary TB? How do we manage not only his TB care, but also his oncology appointments with other vulnerable cancer patients? What about him needing to stay in isolation, but also balancing spending his final days with his family? These are a few examples of what I work through on a daily basis as the case manager in the tuberculosis program. It can be a bit of detective work, which guarantees that no 2 cases are ever the same and I'm never bored. It's looking at the patient as a whole, taking their work, social circle, and life stage into consideration when providing care. I work with all individuals who are being investigated for suspected TB, those with newly diagnosed and confirmed TB, along with following up with anyone they may have come in contact with. As you can imagine, my work takes place in a variety of settings with patients of all age ranges. I get to be a part of my patients' lives for anywhere from 6 months to 2 years or more. It's a nice opportunity to see them through what can sometimes be a very scary part of their lives. Working for the TB program is unique, as I get to see the progression as the TB medications start to work, they start to feel better, and then they complete their treatment and get back to their normal lives. In some cases, like the scenario of the patient battling cancer along with TB, being able to be a support for them and their families is very rewarding. Through my role, I am also able to work as a TB liaison with a hospital-based TB clinic, where I see patients in a clinic setting. I help to assess and treat individuals being investigated for TB and those diagnosed with active TB alongside with the treating physicians. I was also able to start a role in partnership with one of our community hospitals in which I work in close collaboration with the hospital's IPAC team to follow up infectious TB exposures. This includes tracing their movements throughout the hospital, deeming who may need contact follow-up, and coordinating their care. When I first started in nursing, I wasn't really familiar with public health or the program areas of work. I was working multiple jobs and thought it would be interesting to apply. All of these experiences at Toronto Public Health have prepared me for my most recent opportunity, in which I was able to work in Nunavut at a TB emergency outbreak response clinic. This has been very important work to me, as there's a significant discrepancy in the northern part of Canada when it comes to TB rates, and I was able to assist in the efforts to support these northern communities. The support I receive from my colleagues in management at Toronto Public Health reminds me of how lucky I am to work here.